The following video is for educational purposes only. Please use this information with discretion. Our intent is to help you become a more informed healthcare consumer. Ortho University presents Biceps and Triceps Tendinitis at the Elbow by Dr. David Eisenhauer. And now it's time to OrthoU.
Hello, I'm Dr. David Eisenhauer. I'm a board-certified and dual fellowship trained orthopedic surgeon specializing in surgery of the shoulder, elbow, and hand. Today we are going to discuss biceps and triceps tendinitis at the elbow, how to diagnose this and how to treat this. We'll give you some simple self-diagnostic tools as well as some simple home treatment recommendations which may save you the initial doctor's office visit. So first of all, what is tendinitis of the triceps or biceps tendon? It tends to be inflammation of the tendon as the tendon inserts onto bone. The triceps is the tendon in the back of the elbow that comes down and inserts onto the tip of the olecranon bone of the forearm. The triceps tendon straightens the elbow out. The biceps tendon is its antagonist. It's in the front of the elbow. It inserts on the radial tuberosity, and that is a flexor, but it's also a supinator. So actually the main job of the biceps is to turn the palm up. Most patients don't realize that. We think of the biceps tendon as the elbow flexor, and that's what we work out whenever we're getting big and strong, but actually the main job is to turn the palm up. So it's a supinating muscle. If either one of these tendons become inflamed for a variety of reasons, most common of which would be overuse. So weightlifters or anyone doing a repetitive motion type job can cause inflammation of one of those two tendons. Occasionally, a significant tendinitis can become a partial tendon tear, or occasionally those tendons can traumatically tear or even completely rupture off of their bone insertions. But if these tendons are just irritated and inflamed, and by the way, this is not a common diagnosis. There are other things in the elbow that cause elbow pain that are much more common than biceps or triceps tendinitis. But just to complete the video series here, I want to touch on this a little bit. So, what are some self-diagnostic tools? Well, you really want to delineate where the pain is coming from. And in the other videos, we discussed tennis elbow, golfer's elbow, cubital tunnel syndrome. We discussed elbow arthritis. So you really need to pinpoint where the pain is. Is the pain right at the very tip of the elbow and just rolling up from that? That's where the triceps inserts. This may be a triceps tendinitis. Is it in the very front of the elbow? If you follow the palm up to the very front of the elbow and kind of bend the elbow up and bend your thumb towards the ground, you can feel the biceps tendon. It's the most prominent tendon there, and it's about as big around as a number 2 pencil. So if you can feel that and palpate it down into the forearm where it inserts, a triceps tendinitis will generally be quite tender there. The other thing you can do to elicit pain is you can resist extension. So keep from straightening the elbow. That causes pressure and tension at the triceps insertion, and that may elicit pain. Same thing with the biceps tendon. Try to resist flexion and particularly resist supination. That can cause some pain at the biceps insertion. In the office, I will do the same exact maneuvers, and we'll see if we can elicit a painful response and kind of pinpoint what's the pain generator for you. We'll also get x-rays and look for any bony abnormality. Occasionally we'll see a bone spur off the tip of the olecranon called a traction osteophyte. We can see this sometimes with a chronic tendinitis of the triceps tendon. We'll look for other bony abnormalities such as arthritis or any malalignment of the bones which may be causing your elbow pain. Oftentimes, in fact, very often we'll obtain an MRI. The MRI evaluates soft tissues, so everything that we can't see on x-ray, typically we can see on MRI. We can see the tendons, the nerves, the ligaments, the muscles, etc. on MRI. And we'll look for inflammation around those tendons or sometimes partial tearing of those tendons on MRI of either the biceps or the triceps.
We pause now with 2 minutes left in the video and ask that you open a separate browser screen and go to MoonlightOrtho.com, where you can quickly register for a free patient account and get immediate access to the final portion of this video, including home treatments and remedies, along with any additional treatments that may be prescribed or recommended in office or via telemedicine, including when it may be time to consider surgery. This also gives you full access to the entire OrthoU video library, highlighting all of the most common orthopedic conditions. Once registered on Moonlight Ortho, patients will have an all-inclusive orthopedic telehealth hub at their fingertips and can pay to be seen by a board-certified and fellowship-trained orthopedic surgeon. Moonlight Ortho is the first and only orthopedic-specific telemedicine practice where patients can be seen online by a board-certified orthopedic surgeon. Via telemedicine, patients can receive X-ray, MRI, lab, and physical therapy orders, along with prescription medications, all within 24 to 36 hours from your time of visit. Thank you for watching, and if you enjoyed this video and appreciate the free advice that our surgeons have offered you, please rate and subscribe.